Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. Welcome, Vaughn.
Hello.
I would like to remind everyone that we request you send in your COVID-19 related questions to us at podcast@mitw.org. I'd also like to let people know that we have more information on the upcoming Neopit vaccine clinic that we mentioned in last week's episode. The clinic will be at the Neopit Community Center on Friday, April 9th from 2 to 5 p.m. Walk-ins are welcome. However, if you'd like to make an appointment, you can call 715-799-5769. Just remember that you have to be either 18 years or older and fit any one of the following categories: a Menominee enrolled member or descendant, live on the Menominee Reservation, work on the Menominee Reservation, live with a Menominee member or descendant, or with someone who works on the reservation, or if you're a patient of the Menominee Tribal Clinic. We also have another mobile vaccine clinic that will be coming up on May 7th in South Branch. We don't have any details on that right now, but we will get those out as we get closer to that date. So to get into our questions for this week, Vaughn, can you talk a little bit about the rise in cases in Wisconsin and what that would mean for us locally?
Yes. So as of March 31st, so yesterday, there are 6,825 active cases of COVID in the state right now. 351 of them are on ventilators. And this is out of the 2,394 ventilators that are, across the state and in various, healthcare facilities. 233 of these individuals have been hospitalized. 74 of them are in some form of ICU. Right now, there are only about 18% of hospital beds available across the state. So that's kind of where we are right now as far as the active cases. For whatever reason, they've talked about how over the last week there's been a spike in the number of COVID cases. We're not really sure why that is, but combing through a bunch of the data, it looks like, for whatever reason on March 22nd, there was a fairly major spike in the number of COVID cases across 25 different counties in the state. Some of them are near us, like Outagamie County. And so it's important for us to, bear in mind that there are communities out there that haven't been able to, contain, slow down, direct the virus nearly as well as we've been able to locally. So keep that in mind, especially if you're, going to be traveling and stuff over the weekend.
I know you said we don't really know why the rise in cases is happening, but could that be due to variants making their way into the area?
According to the CDC data, it might be. We have recorded cases of the P1 variant and the B1351, which I believe were South African and Japanese. But it looks like those haven't been a huge cause because for each of those variants, there's less than 150 cases and stuff in Wisconsin. So it looks like it's more due to what they'd call the wild variant or the original strain.
So Vaughn, do you have tips for people who are going to be celebrating the Easter holiday with family this weekend?
The best thing we could do right now would be get vaccinated beforehand if that's possible for you. We do have walk-ins for vaccinations day like we've talked about. Keep celebrations small, under 10 people if possible. Only celebrate with one other household. If you're going to be, eating together, ideally don't share food, have things that are single servings like we've talked about, use disposable dishes, wash your hands really frequently. A lot of the same types of recommendations that we had around, Thanksgiving and Christmas and stuff about, just making sure that everything is sanitary. And, if you celebrate outside, there's a lower concentration of viral particles that can accumulate. And so you can be healthier if you can have that outside. So, consider holding outside. It's supposed to be good weather.
Can you talk a little bit about updated numbers on where we're at in vaccinations this week?
Yes, we've vaccinated approximately 2,500 people. We've vaccinated over 87% of our seniors and over 65% of our over 55 population. What we are struggling with right now is bringing in the younger population and having them, kind of take responsibility to help keep the spread of COVID down. So we would really like to encourage, anyone that's over the age of 18 on the reservation to really consider getting a vaccination to, help protect those around you.
Has the tribe considered having more expanded hours for vaccine clinics?
Yes, and we're actually looking at doing a couple expanded clinics. I want to say, I'll get back to you on the dates and that. We'll put those dates in the show notes.
Okay. So can COVID be passed from mother to child?
Based on what we know right now, pregnant women are at increased risk for contracting COVID. But what they've seen is they don't think it can pass to the fetus at this time. What they do know is that commonly, if a woman contracts, COVID and is experiencing SARS-CoV-2, it has the risk of triggering premature birth, which is any birth before 37 weeks. Normally, 1 in 10 babies is born, a little early. But it's kind of a dangerous thing for, birth to be brought on early. If a child is born early before 32 weeks, they could have difficulties breathing or feeding. They have increased risk of things like cerebral palsy and developmental delays. They can also have vision and hearing problems. And they're at an increased risk of, premature death. So there have been some Chinese studies that, like I mentioned, suggest that it can't be passed from mother to fetus. However, it is also easier for, the infant to contract it right after birth. Right now, the University of Washington is conducting a study to see what the prevalence of, transmission is from mother to fetus. Also from pregnant mother to household members that live with them and stuff. So they're gathering more information. People would like, we can put the links to those studies in the show notes. They have found, researchers found that anyone who gets COVID antibodies, that actually is passed on to the fetus and the baby through the umbilical cord and through blood and breast milk. So they are, I don't know if they're actively encouraging it, but they've allowed for pregnant women to receive vaccinations at this time because they do feel that it can provide antibodies to the baby. And so that's an option now. They do recommend that those women talk to their healthcare provider before doing that, though.
Okay. Can you talk about women who are on hormonal birth control? I know they're already at a higher risk for blood clotting. And I know that blood clotting is an issue with COVID. So are they at higher risk of blood clotting due to COVID?
This is kind of like the pregnancy question. There's still a lot of things we don't know. And so right now they're trying to find out, if, hormonal birth control will put someone at a greater risk for contracting coronavirus. I know the Cleveland Clinic has done some studies on it. They say it's a really low risk right now. But like I said, they're still looking into that.
Are smokers more at risk to contract COVID than non-smokers?
So smokers and those with a history of respiratory illnesses aren't necessarily more likely to contract COVID, but they're more likely to have a severe case especially with long-term effects if they do contract COVID. The question of who's more likely to contract COVID really comes down to things like environmental influences, like your occupation, whether you're a frontline worker in a back office setting, your living conditions, like the number of people in your specific house or the population density in the city you're in. And then there are also, how much are you using precautionary efforts like washing your hands and, physical distancing, vaccinating, etc.
I kind of thought that would be a possibility due to when you're smoking, you kind of have close contact with your mouth.
Oh, yeah. Yeah. That is a good point of cross-contamination. I didn't think that.
Will getting the vaccine cause someone to test positive on a COVID-19 test?
It shouldn't, because you're not actually breaking down any of the virus. You don't have it in your system. So those markers that are used in this test shouldn't pick that up.
Did you have any final advice for people for the weekend?
Enjoy the holiday celebrations. Please get vaccinated. Stay safe. Stay healthy. Wash your hands. Don't kiss strangers. And have a good weekend.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-msn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them to us via email at podcast@mitw.org.